Good evening, everyone. Welcome to week 8 of Module 4, assessment for CAA aspirants. And we shall review the bladder channel of foot Taiyang and the kidney channel of foot Shaoyin. Okay, so let's start with foot Taiyang bladder channel. So this bladder channel, the primary channel, begins at UB1, bladder 1. I think we all know where bladder 1 is, at the inner canthus of the eye. And then it goes up the forehead, intersecting the DO channel at DO 24. So kitang-kita nyo po yan dyan. And also the gallbladder channel at gallbladder 15. It then crosses to the vertex and again intersects the DO channel at DO 20. So from here, we have a branch that descends to the area above the ear. So this joins the GB channel at GB7, GB8, and GB12. A vertical branch enters the brain at the vertex and intersects with the DO channel at DO 17 before emerging and descending along the nape of the neck and the muscles of the medial aspect of the scapula. Here, the bladder channel meets the DO channel at DO 14 and DO 13, after which it continues downward parallel to the spine to the lumbar region. Then the channel enters the internal cavity via the paravertebral muscles. Kaya this is very helpful, especially when you locate the back shoe. Communicates with the kidneys and finally joins its associated organ, the bladder. Another branch separates in the lumbar region, as you can see from the figure, and it crosses the buttock and descends to the popliteal fossa of the knee. I actually love needling bladder 40 because I heard it can grow your hair. O, di ba? Kaya lang nakalimutan ko magdala ng nito. Okay, so you have to be patient. I will show you na it's working. So it's so easy to needle yourself. Then we have another branch that separates from the main channel at the back of the neck and descends parallel to the spine from the medial spine of the scapula to the gluteal region. Here it crosses the buttock to cross at GB30. So this is another very important point, gallbladder 30, and then descends. Diba GB30 is very good for sciatica, no? So you have to let the patient assume a lateral recumbent position. And then it descends across the lateral posterior aspect of the thigh to join with the other branch of this channel in the popliteal fossa. Continuing downward through the gastrocnemius muscle. Don't worry, we shall deal with this anatomy by January or February, okay? So I know you're all excited. The channel emerges behind the lateral malleolus, and then it follows the fifth metatarsal bone, crossing the tuberosity to the lateral tip of the little toe at bladder 67. The bladder channel connects behind the knee with its lower Hussey point, the bladder 40. No? So this channel connects with the kidneys and is joined directly with the brain and heart. So yon, crossing points. So as you can see from the figure, DO 24, DO 20, DO 17, DO 14, DO 13, GB7, GB8, GB10, GB11, GB12, GB15, and GB30. Okay, so what is the clinical significance? So we can determine if we have mastered the pathway of the primary channel, then you would be able to differentiate between exterior and interior. So if it is an exterior symptom, then you would expect the usual, no? Memorize na natin to, no? The invasion with external invasion, chills and fever. And siguro by this time you already understood. You have already understood bakit may chills, may fever, no? Headaches, occipital stiffness, and of course, to really pinpoint that this is a bladder issue, there will be pain in the lumbar region, then obstruction of the nasal passages dito, no? Bladder 1. Kaya opposite, no? Eye pain with tearing, pain along the posterior aspect of the hip, knee, and foreleg, and foot pain. So if it is an interior issue, that means the Zhang organ is already involved. The Zhangfu organ, rather. So it's the bladder. So meron na pong pain and tension in the lower abdomen, retention of urine, so that speaks very, very obvious of the bladder. Enuresis, you wet your bed. Psycho-emotional disorders, opisthotono. So this is a posture that everyone should be very familiar with when you see patients, no? So next we go to the luo-connecting channel of the bladder. So luo-connecting channel, medyo humihiwalay po siya. So you have to remember the point called bladder 58. Yeah, bladder 58. So the bladder luo connecting channel separates from the primary channel at bladder 58 to connect with the kidney at what point? What's the source point of the kidney? Kidney 3. So this is, so ibig sabihin, when you needle this point, you're actually affecting the kidneys, okay? That's why it's called a luo channel. What is the clinical importance? To determine whether the issue is excess or deficient. So if it is excess, there is obstruction of nasal passages. So if it's excess, you have to sedate, no? Clear watery nasal discharge, headaches, and back pain. It is a deficient condition if there is nosebleed, chronic clear nasal discharge, and sinusitis. Then we go to the divergent channel, okay? So the divergent channel diverges from the primary at the popliteal fossa. Okay, so saan yung popliteal fossa? Alam nyo na po. And then it travels to a 0.5 soon below the sacrum. Okay, it then detours to the anal region, connects with the bladder, and disperses in the kidneys. From here, it follows the spine and disperses in the cardiac region before emerging at the neck, where it rejoins the bladder primary channel. So nagre-rejoin po ang bladder divergent channel sa bladder primary channel. So what is the clinical importance of knowing the bladder divergent channel? Strengthens the relationship between the bladder and kidney. So points on the bladder primary channel can be used for disorders of the kidney, and also vice versa, no? Supports connection between bladder primary channel and the heart. Okay, kaya if you have heart issues, you will also have bladder issues. Supports the connection between the bladder primary channel and the anus. Okay, kaya di ba pag naiihi ka, pag hindi ka pag nakadumi ka, umiihi na. Okay. Napansin nyo yon? I'm sure nakaka-relate yung iba. Yung iba ayaw lang aminin. Creates connection between the popliteal, because it's very common pag medyo mahina na po ang kidney. No? Yan. Because of maturity. I want to use maturity than, or maybe seniority. Okay. So it creates the connection, the divergent channel between the popliteal region. So whenever you talk about the popliteal region, you talk about the bladder 40, and the sacral region, bladder 32 and 31, as well as with the occipital region, bladder 10. Then finally, we go to the sinew channel or the muscle channel of the bladder. Okay, saan po ito nag-originate? As you can see, it originates at the middle toe. Little toe, sorry. Little toe, kasi 67. Proceeds upwards to the external malleolus and then to the knee. A lower branch extends below the lateral malleolus to the heel, and then ascends to the lateral margin of the popliteal fossa here. Another branch separates at the convergence of the medial and lateral heads of the gastrocnemius muscle and ascends to the medial margin of the popliteal fossa. These two branches join in the gluteal region and continues upwards along the side of the spine to the nape of the neck, where a branch reaches inward to the root of the tongue. Okay? Above the neck, the channel joins with the occipital bone, and then it proceeds over the head to the bridge of the nose. So a branch will cross the top of the eye and connects at the side of the nose below. Another branch will extend below the axilla, sa may kilikili, and over the chest. This one. Kaya yung nagko-complain na masakit yan, you know what you will do. Okay? So it extends from the lateral margin of the posterior axillary crease to LI15 on the shoulder here. Okay. Another branch crosses below the axilla and over the chest, emerging at the supraclavicular fossa and ascending to GB12 behind the ear. Still another branch, and daming branches. After emerging from the supraclavicular fossa, traverses the face to a site beside the nose. That is why it is very important to needle LI20 when you do acupuncture facelift. So, nakakatulong talaga, nawawala pati yung back pain, no? So, clinical importance, pathology of the sinew channel, of course, sinew yan, yung muscle ang involved. So, there will be muscle cramps in the region of the little toe. Sometimes, masakit yung heel, no? Stiffness and limited range of motion in the joints. There will be tension and stiffness in the back and along the spine, and difficulty when you bend forward. So, let's see if you can relate. Inability to lift the arms above the shoulder region. So that's involvement of the sinew channel of the bladder. Stiffness or distending pain in the axillary region, pain and tense musculature in the supraclavicular fossa, limited range of motion of the cervical spine. So indication, mainly this is painful obstruction syndrome or the P syndrome along the bladder channel. Okay, so that means hindi pa involved talaga yung bladder organ. Area covered by the bladder sinew channel is larger than that covered by the bladder primary channel. So this explains why bladder primary channel points can also be used for disorders of scapula and shoulder region, as well as for disorders of the lower eyelid and nasal region. Okay? So, the tonification point is bladder 67, sedation point is bladder 65, horary point is bladder 66. So bladder 1, kung marunong ka mag-needle, pero I know si Dr. Sam and the family know how to needle bladder 1. You just have to be very careful, no? Always use that guide tube, okay? And don't do any manipulation kung ayaw mong may mangyari sa mata. But if you're a bit unsure, don't do it. You use bladder 2 instead. Pareho lang yung indication and sinuses, frontal headaches. Okay? Bladder 7, sinuses, headaches, dizziness. Bladder 10, so sa neck problems, energy problems, sinuses, headaches, mental and emotional, with bladder 11 for depression. See, bladder 11 is very good for depression. Bladder 11, bones, wind point, URI, upper respiratory infection. Bladder 12, wind, sinuses, lung problems. Bladder 13, alam naman natin, lung problems and night sweats for lung yin deficiency. Especially pag may kidney yin deficiency ka na, may edad na. Bladder 14, neurasthenia, heart problems. Bladder 15, heart and spirit problems, anxiety, physical heart. Physical heart. So, ibig sabihin yung heart mo mismo may problema. Okay, you have to needle bladder 15. That's how important the back shoe is. Ang haba pa naman ito. Bladder 16 is for balding. Oh, okay, governor. It's also for the skin and the diaphragm. Bladder 17 for the diaphragm. It's also called the blood point. This is my favorite whenever the patient complains of pain, no? Blood stagnation. So look at the tongue, it's purple. And again, it will all depend on how you are able to locate bladder 17. You have to ask the patient to do something. And that is better discussed sa actual, sa practicum. And I'm sure some of you already know how to locate it. Bladder 18 is for liver stuff, eyes, headache, stagnant blood vessel problems. So liver yan. Bladder 19 naman, gallbladder, like stones, nausea, shingles. You know shingles, herpes zoster, yung tinatawag na parang sa Bisaya pa sa amin pala, culebra. Oh, culebra is snake. Okay, so bladder 20 tonifies the spleen because it's the back shoe of the spleen. So any issue with digestion, there's dampness, builds blood. So especially for those people na malnourished, no? Prolapses. We all know that when you have spleen qi sinking, it's actually spleen qi deficiency. Okay, bladder 21 for digestive, stomach problems. Bladder 22, it's very triple burner or sanjiao, waterways, fatigue, low back pain, urinary edema. Bladder 23, very favorite. Ay, nako, ang daming pasyente nito. Kidney problems. Okay, alam nyo na po yan. Bladder 25, back shoe of the large intestine, right? Constipation or diarrhea. Bladder 27, ileitis or inflammation of the ileum, blood in urine. So that's hematuria, enteritis. Bladder 28, urinary system, cystitis, prostatitis, UB29, mid-back. Bladder 30, vaginal discharges, rectal diseases. Bladder 31 to 34, menopausal, and also for hormonal imbalance. Bladder 43 for chronic diseases, strengthens the lungs. Okay? So you know how to locate bladder 43. So it becomes 3 tuned from the midline. Bladder 43, chronic diseases, strengthen the lungs. Bladder 52, to build the kidney yang. So madali lang po ito. Bladder 23, ang kidney. So you just add 29. So that's bladder 52. Yung mga medyo mahina ang willpower, no? Or kung gusto mo magpa-impress, you needle bladder 52 on the ear. Okay. Bladder 30. Alam mo, Dr. Sam, every time I see your face, na-excite ako sa darating mo ng mga colored ear seeds, no? I'm so excited. So expect a lot of people. I've tried it. I ordered from someone, no? Gustong-gusto talaga. And she felt na maganda tingnan talaga sa ear. Okay?
Yes.
Bladder 39, we're looking forward to that, Doctor. Just let us.
Yes, actually coming na po, Doc. Matagal kasi imported eh.
Oo nga eh. Sana abot kaya.
Abot kaya yan.
Okay. So yun. I'm very, very excited. In fact, I don't know if this is the right platform to actually discuss this. I believe that there are a lot of people out there na may pinagdadaanan. And, it's so easy. At saka very sensitive yan sila. Ayaw na ayaw nila maraming needles. So especially when they see the needles are good looking and they will be proud. So tatak na yan. Hashem, di ba? Excited po ako. So I'm hoping that everything will be fine next year. And I can feel naman, no? Low back pain, bladder 40, whether acute or chronic, you use bladder 40. You can also use this for heat stroke, heat in the intestines. Bladder 57, traumatic injury, muscle strain. So it's very good for athletes, no? Also for hemorrhoids, constipation. Bladder 58, rheumatoid arthritis, chronic low back pain, nose problem. Usually I combine bladder 40 and bladder 58. Yeah. Bladder 60 naman, wind, relaxes muscles. It's good for sciatica and low back pain, headache, stiff neck. Bladder 62, yang chow. Okay, so I hope you will have the time to actually also study the other EOVs, extraordinary vessels, no? The yang chow mai, yin chow mai. Yeah. So since this is the bladder, so we'll talk about the yang chow mai. Okay, bladder 64, stiff neck, myocarditis, headaches, and bladder 67, turning the fetus. I hope you already know by this time at ano po yung age of gestation na pwede mo pang i-turn yung baby. Okay, week 28 to 32, am I correct? Week 28 to 32. So, kailangan alam nyo po kung paano, kasi when you're assigned in the barrios, in the community, it is always important to determine kung kailan po, ano po yung age of gestational age ng feto, ng pregnancy niya, di ba? So, it's actually the first day of the last menstrual period or the last day. Okay, so I want you to research that. Okay? Kasi yung iba, hindi alam yung prenatal. Can you imagine? I had this very unforgettable experience. I was doing my rotation as a clerk in a government hospital in Cebu. Yun nga, walang prenatal. Nasa OB ako nagro-rotate noon. And so it happened na breach yung presentation. And in a government hospital, to prepare for a CS is almost an impossibility. You need ample time. Lumalabas na yung paa. Okay. So we lost the baby, in short. So can you just imagine if we can only bring this to the community, alam nila kung kailangan nila na, marunong ka makinig ng fetal tones, no? Marami tayong matutulungan. So kailangan matuturn pa natin yung baby at age 28 weeks to 32 weeks. Okay? You do moxa o bladder 67. Excited? Okay. Now, ang haba ng aking intro, ang haba kasi ng bladder. Who would like to volunteer? Sino ba una
Ako po, Doc.
Okay.
May sagot ako ngayon.
Okay, very good. So, lahatin mo na, Ma'am Joy.
Huwag mo lahat to. Yung 14 po, Doc.
Sige, go.
Sana lang po tama.
Okay. Sige,
Okay.
bladder 13. Sabihin mo yung sagot. And the letter.
Bladder 13, Doc, is letter D, long shoe point.
Correct. Number 2. Bladder.
Number 2, bladder 14 is letter E, pericardium shoe point.
Wow. Great. Bladder 15.
Now, bladder 15, Doc, is letter J, heart shoe point. Tama ba, Doc?
Yes.
Wait, nasa ba yung aking,
Should not be unsure.
aking
We should
coding.
always be sure. Bladder 16.
Bladder 16, Doc, my answer is letter M, governing vessel shoe point.
Okay, very good. Bladder 17.
Bladder 17, Doc, letter N, diaphragm shoe point.
Okay,
Doc, ngayon ko na narinig yung diaphragm shoe point.
Yeah. Yeah, kasi hindi pa natin diniscuss yan. I-discuss yan sa ating Okay, numbers.
And then number 6 po, Doc, bladder 18. My answer is liver shoe point, letter C.
Letter C. Very good. Bladder 19.
And number 7, bladder 19. My answer, Doc, is gallbladder shoe point, letter I.
So bladder 20.
Bladder 20, number 8. Letter B, Doc, spleen shoe point.
Okay.
That's my answer.
Very good. You're very
And number 9.
Yeah, bladder
21.
21.
Wait lang, Doc. Number 9. Is stomach shoe point, Doc.
Okay, letter H. Good.
And then yes,
bladder
letter
22.
H. 22 is letter L, Sanjiao shoe point.
Galing.
And number 11, UB23, is letter F, kidney shoe point, Doc.
Okay, very good. Number 12.
And then number 12, my answer, Doc, for UB25 is large intestine shoe point, letter A.
Great. 2 more.
And number 13, bladder 27, letter G, Doc, small intestine shoe point.
And finally, bladder 28.
And bladder 28, Doc, bladder shoe point.
Okay. Congratulations.
Thank you, Doc.
Parang halatang-halata, medyo kagrupo mo ang Hashem. Okay.
Sana nga po, Doc, maging nila ako. Ano ba tawag doon? Maging ko sila, mentor.
Yeah. And then, ikaw yung magiging mentor ng Baguio. So, I think, ramdam mo yung ngiti ni Dr. Sam talaga. So, well, I really envy you because you're so full of talent. And, this one just proves to everyone that what we're doing na effective yung ating And if I'm not mistaken, you came at the middle na of the di ba? Parang ang bilis. Kailan ba ko sa Baguio? June yata yun?
Yes, Doc. June po.
Tapos,
so, nag-start po ako ng
July, August, pinigit ka pa namin. Ang bilis. Okay. Yes. Congratulations. So, we hope we can educate people in Baguio.
Thank you, Doc.
Thank you very much. Good job. Excellent job. Thank you po.
Thank you po.
Now, let's call on someone who would like to volunteer. Volunteer. Tatawag ako. Hindi ko pa naririnig. Oh, Sir Michael. Siguro nakapagpahinga na si Sir Michael, naka-recover na. I did not call you last time. So, Sir Michael, are you there?
Hello, Doc.
Yeah. Your voice sounds very prepared. So, 15, 21.
We'll try po.
Don't try,
Okay,
do it.
I will do it.
Okay, bladder
In
7.
numbers, bladder 7, my answer for this one is eliminate eliminate the winds, rhinitis, headache, loss of sense of smell. Letter C po.
Okay, very good. Number 16, bladder 10.
For my bladder 10, dispel wind, occipital headaches, stiff neck, mental or emotional stress. Letter A
Wow.
po sa akin.
Letter A. Good, correct. Number 17, bladder 40, very common.
For this one, bladder 40 is drain summer heat, acute
Yes.
rhinitis, low back pain, and sciatica. It's letter E po.
Kaya para ano, yung mga na-heat stroke, no? This is very good, bladder 40. Number
Yes.
18.
For number 18 po, gallbladder 43, strengthening deficiency condition, asthma,
Gallbladder,
bronchitis.
urinary bladder.
Mm. Urinary bladder, strengthening the deficiency conditions, asthma, bronchitis, general weakness.
Okay, very
Letter
good.
F po.
Yeah, correct. Number 19, bladder 57.
Bladder 57, relax the muscle channel, benefits hemorrhoids, sciatica.
Hemorrhoids.
Letter B po sa akin,
Hemorrhoids, hindi hemorrhage.
hemorrhoids.
You know what's hemorrhoids in Tagalog?
Almoranas.
Parang pasa.
Anong pasa? Grabe. Hindi mo
Almoranas po.
alam.
Maga.
Hindi mo alam.
Almo.
Tagalog.
What's hemorrhoids in Tagalog?
Almoranas po.
Almoranas.
Yes.
Okay. Okay, so number 20, bladder 60.
Ang bladder 60 ko po is relax senior and muscles, benefits sa lower back, and sciatica, stiff neck, headache, pull of the down.
Okay.
Letter D po siya, letter D.
Marami pong nag-i-stiff neck, lalo na pag office worker, tapos yung computer screen mababa, hindi eye level. No? Bladder 60, try it. Para mas ma-impress, ilagay mo yung bladder 60 sa tenga. Okay? By the way, siguro right after this, I'll be working on the notes that I promised all of you. Hopefully, we can use it for depression. Napansin nyo, no? You can actually do two things, no? Yung 5 spirits, di ba? We talked about willpower, ano pa yun? The Hun, the Shen, di ba? Okay, so siguro ipapakita ko lang doon yung ear point. I will presume that you already know the body points. Isn't that exciting?
Thank you po, Doc.
Yeah.
Yes,
okay.
po. Very helpful po yan, Doc.
Very good. And then we will deal with the pattern later. Unahin muna natin yung base the symptoms. Number 21, Sir Michael, the last one.
62 is clear the spirits, open the young heel channel, Meniere's disease.
No, that's Meniere's disease. You Google it. What is it? What it is? Okay.
Headache.
Letter G. Meniere's disease. Meniere's. Okay. So that's correct. Letter G. Maraming salamat. Good job, Sir Michael. You did not commit any mistake. So impressive. Thank you po. Okay, meron pa tayo. Ang haba kasi ng bladder, 22 to 29. So I would like to call on, Angelita Ramos. Seryoso na si Miss Angelita. Ma'am Angelita, can you show your face?
Hello, Doc. Good evening.
Yeah, I remember you promised to really stop. Okay. Nag-transform ka na talaga ngayon. Ay, ang ganda. Okay, let's go to number 22. Famous point for turning.
22, Doc. Famous point for turning fetus. UB 67, Doc.
Very good. Meeting point for young Chow.
67.
Meeting point for young Chow.
Meeting point for young Chow is urinary
Bladder,
62, Doc.
62. Okay. New connecting point of the bladder.
Hello, Doc.
Number 24. Bakit mahina yung signal?
Lumin na yung signal.
Okay, Lou point. 24.
Hello. Nasa Doc.
Bladder,
58.
58.
58.
Very good. C of energy
58.
point. One of the 4 C's ito. Saan yung C of energy point?
Doc, yun ang wala akong.
Ay, dapat meron ka niyan. Sige.
Doc, wala
Skip
akong
mo
sagot.
muna yan.
Sorry.
Isipin mo yan. Horary point.
Yes.
Horary point.
Horary point yan, Doc. Okay. Horary point of
No.
bladder
Anong sagot?
is
Horary point ng bladder.
66, Doc.
Okay.
Bladder 66.
Fire point.
Horary point, bladder 66, Doc.
Fire point.
60, Doc.
Okay,
Urinary
very
bladder
good.
60.
Source point.
Bladder 60, Doc.
Ay, hindi ah.
Source point, Doc. Bladder 64.
Bladder 64.
64. Doc.
Point you would be
Mali
most
ako, Doc.
afraid to needle.
64. Yes, Doc. 64.
67.
Okay. Number 29. The
UB1.
point na medyo nakakatakot i-needle.
UB1, Doc.
Okay. Ano pa yung Okay. Sige na. Yeah, bladder 1. Also stomach 1. 'Di ba?
Ay,
Alam na
stomach
saan.
one.
Okay, but siguro sa rivalida
Lapit
mo,
sa mata.
ide-demo mo kung paano mag-needle. Okay, i-drawlats tayo ha kung paano mag-needle. Kailangan marunong
Sige,
ka.
Doc.
Okay. Let's go back to C of energy point. Thank you very much, Ma'am Angelita. Nag-aral ka
Yes,
talaga.
Doc.
Lata. Okay. Pero wala kang
Yun lang
sagot
yan,
na
Doc.
25.
Medyo na-rush, Doc, eh. Ngayon ko lang po talaga nalaman. Kala ko, Doc, January pa tayo.
Ay, hindi na. Di hanggang ngayon pa. Ha? Iba yung January, 9 and 10. January
Okay,
8
Doc.
onwards. Kaya para
Doc.
paparty kayo dyan eh. So, tiyaga muna. Okay, go.
Sorry, Doc, late pa lang.
Energy point. Anyone who has an answer here?
It's bladder 22, Doc.
Bladder 10.
Bladder 10. Oh.
Okay. Sige, okay lang. Ay, meron pa pala. Okay. Dami pala nito. Okay, let's call on... sino pa ba? Oh, Ma'am Annalyn. Ma'am Annalyn, good evening.
Good evening po.
Okay, how are you? Oh, you look good. Okay, let's go to number... Pwede mong sagutin? 30 to 38? Chicken lang, no?
Sige po.
Okay, 30 to 35 muna.
For number 30, urinary bladder 52.
Hmm.
Letter C, build the wheel, nephritis, low back pain, and spermatoria.
Okay. Alam nyo naman, magkatabi po ang bladder 23 and bladder 52. Okay? So, this is very good for those people na mahina ang loob. Okay? Those who do not have the persistence to or walang survival mode. Okay? So, para lumakas yung loob, you use bladder 52. So you have to locate bladder 23 first, then another 1.5 June, that's bladder 52. Bladder 11, Ma'am Annalyn.
Yes po. It regulates the joints, induces perspiration,
Okay.
common cold, and osteoporosis. Letter
Yeah,
A.
very good. Letter A. Number 32, bladder 32.
Bladder 32. Letter D, it regulates the menses, stop vaginal discharge, removes blood stasis in the uterus.
Very good. Okay, number 33, bladder 39.
Bladder 39. It regulates the water pathway, benefits the bladder, low back pain, nephritis, and cystitis. Letter E.
Okay, great. Correct. Number 34, bladder
Number
58.
34, bladder 58. Letter B, disperses wind and damp, builds the kidneys, rheumatoid arthritis. hemorrhoids, and low back pain.
So what's the Tagalog
Bladder
for hemorrhoids?
almoranas.
Okay. Yon. So effective po yan. Okay. And bladder 59?
Bladder 59, letter F, the cheek left of Yang Chow Meridian.
Okay, good. Now let's go to 36, 37, 38.
Lower his C of Sanjiao, that is urinary bladder 39.
Okay. Lower husi of bladder.
Urinary bladder 40.
Very good. Contraindicated in pregnancy.
Yung urinary bladder 60.
Okay. Maraming salamat, Ma'am Annalyn. Okay, so thank you po. Good job. Excellent job. Walang mali. Thank you. Now, let's go to foot Shaoyin kidney channel. Okay, ito po yung primary channel. As you can see, nagbibigin siya beneath the little toe. Okay? Crosses the sole of the foot and emerges at kidney 2 on the inferior aspect of the navicular tuberosity of the instep. So from here, nagta-travel po siya posterior sa medial malleolus. Siyempre, kidney na to ha, medial na, yin. Enters the heel and proceeds upward along the medial aspect of the lower leg where it intersects the spleen channel at spleen 6. Then, patuloy siya up the leg within the gastrocnemius muscle, traverses the medial aspect of the popliteal fossa and the medial posterior aspect of the thigh to the base of the spine where it intersects the Du channel at Du1. Here, it threads its way beneath the spine to enter its associated organ, which is the kidney, and to communicate with the bladder. It intersects the conception channel, or REN, at REN 3 and REN 4. A branch ascends directly from the kidney, crosses the liver and diaphragm, enters the lung, and follows the throat to the root of the tongue. This channel connects with the bladder, joins directly with the liver, lungs, heart, and pericardium. So crossing points are spleen 6, Du1, REN 3, and REN 4. Anong clinical importance ng knowing the kidney primary channel? So to determine kung exterior or interior yung issue. Pag exterior, meron tayong pain in the lumbar region, counterflow cold or weakness of the legs, dry mouth, sore throat, pain in lateral gluteal region and on posterior thigh, pain on the soles of the feet. Sa interior naman, there is pain, facial edema, dark rings under the eyes, yung eye bags na tinatawag, no? Shortness of breath, somnolence, you know what somnolence, tulog ng tulog, restlessness, diarrhea, thin or dry stools, abdominal distension, nausea and vomiting, and impotence. Next, we have the luo channel of the kidney. So, it separates from the primary channel at kidney 4. Dito po yung kidney 4. Then it connects with the urinary bladder at the Yuan source, no? Which is bladder 64. Then a branch will follow the kidney channel upward to a point below the perineum, then threads its way through the lumbar vertebra. Okay? So anong clinical importance? Excess or deficiency. So it is an excess condition if there is retention of urine, deficiency if there is pain in the lumbar region. Counterflow chi, there is restlessness, anxiety, fear, depression, fullness in the chest, and epigastrium. So the luo connecting channel is very good for depression. Then we go to the kidney divergent channel. After separating from the primary at the popliteal fossa, this channel will intersect the divergent channel of the bladder on the thigh. Okay? It then proceeds upwards, connecting first with the kidney before it crosses the girdle channel. You know, the daimai, the belt, or the girdling channel at about the thoracic 7. Thoracic 7 po yan. Here, the channel ascends to the base of the tongue and then continues upwards, emerging at the nape of the neck to converge with the bladder primary channel. So what is the clinical importance? Strengthens the relationship between kidneys and bladder. Points on the kidney primary channel can be used for disorders of the bladder and vice versa. Through connection with daimai or belt or girdling vessel, The kidney points can be used for disorders of Daimai. Kidney chi and essence are sent to the brain through the kidney divergent channel via the spinal canal. So this strengthens the connection between kidneys, marrow, and brain. So it supports connection to the tongue. And finally, we have the muscle channel or the sinew channel of the kidney. It originates beneath the little toe, and together with the spleen muscle channel, crosses below the internal malleolus and connects at the heel, ito po, where it converges with the bladder muscle channel. From here, it proceeds up the leg and connects at the lower medial aspect of the knee. It then joins with the spleen channel and proceeds upwards along the medial aspect of the thigh to the genital region. A branch ascends along the side of the spine to the nape of the neck, where it connects with the occipital bone and converges with the bladder muscle channel. Okay, so clinical importance, pathology, spasms on the sole of the foot, pain or spasms along the posterior medial aspect of the lower extremity, back and occiput, chronic P syndromes, epileptic seizures, limited range of motion with spinal flexion and extension. Okay, so hindi na makapag-bending. Okay, degenerative disorders of bones and joints, spondylosis, osteoarthritis. So what is the indication of the muscle channel or the sinew channel of the kidney? Mainly for chronic pain, spasms, and cold sensations of the lower back and spine accompanied by limited range of motion. Okay? Tonification point, kidney 7. Sedation point, kidney 1. Horary point is kidney 10. Kidney 1 is good for shock. It brings the chi down. Okay? Actually, makakalakad kayo sa apoy pag in-stimulate nyo sa kidney 1. You believe me. Okay. Kidney 2 is fire, especially the throat. It's good for cramping, deficient burning heat. Kidney 3 is for the ears, asthma. So we all know that asthma can be caused by a very weak kidney, no? Hindi niya ma-anchor yung chi. General kidney syndromes, builds yin and yang, builds kidney chi for deficient heat and deficient chi. Most common point po ang kidney 3. Actually, you can use this for diagnosing, no? Mayroon ka makikita mga capillaries dyan, may mga, minsan it's very tender, okay? Kidney 4 is for kidney spirit deficient emotional asthma. Eyes, ang kidney 5, menstrual pain around the navel. Kidney 6 is a major throat point, okay? Builds the yin, more effect on the spirit. Now, this is usually true if you have a patient who is so pagod and would be complaining of sore throat. You can use kidney 6, okay? Kidney 7 builds water, sweat or no sweat. So yung mga nagpapawis or hindi nagpapawis, you use kidney 7. And the she cleft point on kidney 8 for clearing, kidney 9 for excess spirit, kidney 10, water point, cools heat and nourishes kidneys, kidney 11 through kidney 15 for urogenital, pain and redness, inner canthus, kidney 12 through kidney 21, abdominal, kidney 22 through kidney 27 for coughing, asthma, and then you have to palpate for tenderness. So piliin mo lang 22 hanggang 27. So kidney 3, kidney 4, kidney 7 are all for low back pain, chronic deficient, and kidney 2, acute back sprain. So let's call on, sino pa ba hindi ko natatawag? Okay. Okay, let's call Ma'am Ami Glorioso. Ma'am Ami, good evening po. Can you answer 1 to 8? I know you can.
Number 1 po, Doc. Kidney 1 is letter A.
Yes.
Bring chi down, open sensory, refixes hypertension.
Okay. Yeah, so parang bumabalik yung pandinig. Open sensory orifices. Okay. Kidney 2 po, ano po sagot nyo?
My letter, Doc, is letter E.
Kidney 2?
Yes po, kidney 2. Kidney
Wait,
2 or kidney, teka, Doc, letter F. Clear heat and
okay.
fire.
Lahat ng sagot dito, isa lang po ang answer. So, hindi pwedeng or. So ano ba talaga? Kasi kung may kidney
Kasi
yan,
Doc, ang sagot ko talaga letter E eh. Letter
okay.
E po.
Hmm.
Pero may choice din po ako na medyo na ano po ako. Letter F.
Nakakapag ano pa po ng heat ang kidney 2? Nakakatanggal ba
Kidney
ng heat?
2.
Ay, sorry. Ay, yung sagot nyo for kidney 2 is letter E.
Letter E, Doc.
Sino po yung source nyo?
Saan lang po siya? Pinugel ko lang. Doc.
Google? Ay, yung gamitin mo yung ano, yung libro ni Machocha,
Opo.
si
Pero
Padel.
ano po, Doc, nagka-confuse din ako, pero letter F din po kasi eh.
Actually, ang sagot letter F.
Opo. Yung
Alam mo
dalawa nga
bakit?
po eh.
Madam, ganito, pakinggan nyo muna.
Hmm.
Kidney
Sige
2,
po.
di ba nasa ano na, remember yung ating 5 shoe?
5 points po siya. 5
Oh, di
points
ba?
siya.
Clear seat and
Opo.
fire. So, tanggalin
Opo,
mo na po
opo.
itong si E. Huwag ka na ma-confuse.
Opo.
Oo.
Okay, Doc.
So, tonsillitis, cramping, diabetic thirst. Okay, kidney 2.
So, letter F po, Doc.
Okay, letter F po. Number 3, kidney 3.
Number
Ano
3
po
po
sagot
is
nyo?
kidney 3. Letter D,
D, dog.
cool
Ito.
heat. Yes po.
Oo. Yeah.
Letter
Source point po
letter
kasi
D po.
itong si kidney 3. Cool seat,
Opo.
nephritis, tinnitus, asthma, irregular menses. Okay, correct po. Ang kidney 6, number 4, ano sagot nyo?
Kidney 6 po is letter
Remember?
G.
Okay. Kasi 'di ba,
Letter G po.
sore throat, chronic sore throat. Okay?
Yes po.
Comes the spirit, insomnia, irregular menses, dry throat. Okay,
Yes.
number 5, kidney 7 po. Ano sagot nyo?
Number 7, Doc, is letter C. Night sweat, nephritis, UTI, low back pain, edema. Letter C po, Doc.
Okay, night sweat. Yeah, low back pain causes sweat. Okay. Basta sweat issues, sweat or no sweat, you use kidney 7. Okay?
Kidney 7.
So, siyempre, alam mo na kung alin ito tonify, alin ang isisedate. Number 6, kidney 9.
Number 6, kidney 9, excess spirit. My answer, Doc, is letter H.
H.
Yes po.
Okay. Kasi may psychosis, oh.
Apo.
Medyo na ano na. Remember, maganda yan for depression.
Crazy speech.
Okay, crazy speech. Okay.
Yes po.
Parang may kilala tayo. Ay, sorry.
Yes, Doc.
Ay, hindi. Sana mali tayo. Sana mali ako. Mukhang kilala mo rin yan. Ayoko na, baka mamaya maano pa tayo. Wait lang. Okay, so next po.
Kidney 10, Doc, my answer is letter B. Letter B, Doc.
Letter B,
Kidney
boy.
imaging.
So
Yes,
kidney 10 is, how do you classify kidney 10?
Kidney 10 po, Doc, is the water point or hissy point.
Okay, very good. So the answer should be letter B. Builds the
Yes,
kidney and jing. Okay, cool seat. So ito dapat. Okay. So kidney 27.
Kidney 27 is letter letter E.
Yes.
Letter E, Doc.
How many
Build
points?
kidney ang
Nasaan po ang kidney 27? Ilang points po meron ang kidney channel?
27 po.
Okay, very good. Thank you po, Ma'am Ami.
Thank you,
Maraming
Doc.
salamat and excellent job. Thank you po.
Thank you po.
Next, we go to, sino pa bang hindi ko natatawag? We'll reserve the last for ano. Ayun nga pala. Parati ko narinig yung mga boses nyo. Okay, sige, Sino pa ba? Okay. Si ano na lang. Okay, si Ma'am Angel. You will take care of the last one, Dr. Sam. Okay, Ma'am Angel, please. Number 9 to 14.
Doc, good evening po, good evening classmate. Number 9 po, sedation point for the kidney. My answer po is kidney 1 po, Jingwell wood element.
Very good.
Ah,
Okay. Mabuti na lang maikli lang yung sasagutin mo. Mukhang
Opo, papaos ako
kaya
Doc.
pang issue. Okay. Number 10.
Opo. Number,
Tonification.
yes Doc, tonification point for the kidneys, kidney 7 po, classification is Jing River Metal po.
Okay, very good. Number 11, master point ng Yin Chow.
My answer po, Doc, is kidney 6,
Okay.
confluent point of Yin Chow channel.
Sino yung kapartner niya? Sino yung asawa niya?
Ano, Doc?
alam mo na.
Kidney 6, Lu 7,
Lung 7.
Lung 7.
Okay, very good. Number 12,
Number 12, Doc.
matching. Kidney 11, kidney 15.
My answer po is letter B po, Doc.
Urogenital problems. Okay.
Yes po, Doc. Si
Okay.
kidney 11 po is crossing point of the kidney meridian of
Okay,
Chong
very good.
vessel. Si
Okay.
15 naman po, kidney 15 is crossing point of the kidney meridian of the Chong vessel po.
Okay, wag mo akong sisihin pag nawala yung boses mo
Ay,
complete.
sorry, Doc.
Number 13, kidney 12 through kidney 21.
Apo. Sa answer ko po sa 13 po is letter C po, Doc. Abdominal problems po.
Okay, very good. And then finally, kidney 22.
Apo. Number 14 po is my answer is letter A po, coughing and asthma po.
Okay.
Thank you po, Doc.
Ano yung magandang point para sa iyo?
Ano po, Doc, tinry ko yung lung 11, LI 11, tsaka mga lung points po eh.
Okay. Hindi ka gagamit ng kidney? Hindi ka ba nagsusupport?
Wala. Actually, nung nakaraan may sore throat, pero ngayon nawala na, Doc eh. Ano na lang, Doc, napaos po.
Okay. Siguro mahilig ka kumanta. Thank you, Ma'am Michelle. Excellent job. Taiyang nawawala yung boses mo. I hope you can recover your voice back.
Thank you, Doc. Thank you, Doc.
Stop talking. Okay. Thank you po. And finally, Dr. Sam. Yes. 15 to 21. Our curtain.
Yes, Doc. Good evening, everyone. Actually, I'm not really sure my answer, Doc. Is something like confusing kasi si... Ewan ko lang ha. Okay, let's try. Let's do it. For kidney 2, my answer kasi dito is... Hold on.
Remember, alam mo na yung classification ng kidney 2. Tsaka medyo para obvious na kakaiba siya rito sa 4.
Yeah, kidney 2 is actually fire point of the kidney.
Yes.
Yeah, and that can be, the answer can be letter B.
Yes.
We have the burning head and tonsillitis.
Okay, so this is where you sedate it, no?
Yes.
Yeah. So
next is kidney.
Letter B. Kidney 6 is...
Kidney 6 is... This
I
is
think
also...
we up earlier. Sinabi ko
kidney 6 is benefits the throat.
Okay.
So the answer is letter A.
Chronic sore throat, dry throat. Very good.
Right.
Number 17, kidney 3.
Kidney 3, we have... what is kidney 3? It's a U1 source point. My answer is letter, sorry.
Letter. Kidney 3 is a source point. And some types of asthma are characterized by difficulty in inhaling.
Yes.
Diba? You try doing it. So what should be your answer?
Kidney deficient. Kidney deficient asthma yan siya.
Yeah. So talagang may tinnitus pa, low back pain.
Yes.
Okay, very good. And
then Kidney 4, obviously, that's letter C.
Of course.
That's harmonizes blood,
Yeah.
emotionally caused asthma.
Emotionally
And
caused asthma.
That's the low connecting point.
Yes. Yeah. Great. Ang galing. So now alam nyo na impact ng low connecting.
So 19.
Yeah. Yung mga talagang sineseryoso, I hope you're following this, no? You are supposed to use ion source with low connecting, di ba? Yung talagang sineseryoso. But it's up to you. Okay? Source point of the kidney. Ay, very easy.
The source point of the kidney is kidney 3.
Okay, number 20.
Used a lot for eyes, for pain around the navel, and for menstrual problem. Ang answer ko is the cyclic point of the kidney, which is kidney 5.
Yes. So parang so far, all your answers are very sure and they are accurate. So
yes.
What's the problem? Is it number 21?
The number 21, this is actually the last question that I am so confused.
Okay. Yes, because we haven't discussed yung yin
opens and
and
closes the eyes. I think that's the kidney 6.
Yeah,
the master point
perfect.
of yin
Ang galing. Alam niyo, I'm so impressed with all of you. Sa totoo lang. I think you have already developed the ability to actually think, no? And this is something that we rarely see in any every practitioner. And so from the bottom of my heart, I'm so grateful that hindi nawala yung, hindi nasayang yung ating effort. And congratulations everyone. I know medyo na-shock kayo kasi Monday. Sinadya ko talaga yon because I know na there will be parties already towards the weekend, no? So I understand that some of you couldn't make it kasi may ibang appointment, and Monday is usually very abnormal, no? But again, in spite of that, some of you really exerted effort to really come. Okay, so with that, unless you have other questions, I'm so impressed. Thank you, Dr. Sam.
Thank you, Doc.
Yung hindi ka sure. At least you know what to think. You know how to think. You know how to connect things. And this is the hallmark of a very good practitioner. Okay? And I hope that you will all be ready to for the actual thing next year. We'll probably have it by March or April. Maybe after the Holy Week, yung talagang clinics na. But before that, January, February, March, we will be focusing more on the Western. I think the system worked. I did not want to start with the biomedicine first, but instead I've opted to focus on the TCM. Ito naman, ito no, diba? But I think it would be easier if we started with TCM, then we go to Western. Kasi sa totoo lang, nauna naman talaga yung TCM. And so, thank you everyone. I hope I did not make you feel more confused. And everybody did well tonight. And hoping for, a very fruitful year ahead. And enjoy din tayo ng holidays. Wala po tayong webinar for 1 month. And I know you're all aware na time flies so fast. So kaya sinadya ko wala tayong Zoom starting on December 7 until January 7. And but from time to time we will be calling on you for meetings. And if you're available, I am very, very open for comments, for suggestions, or even criticism, no? Kasi I believe that if you would know what is good for everyone. Okay? So again, Merry Christmas to all. I hope I'm one of the first to greet you. And thank you for your support. Thank you for your trust in love. And we hope not to disappoint all of you with the kind of trainings that we're giving you. Dito ko nakita na effective pala talaga ang you don't even have to give lectures so much, 'di ba? Mas effective yung assessment because this will make you get used to really doing your own readings, making your research, not relying so much on Google. Okay? So maraming salamat po, and if there are other references that I can come across, I'm more than willing to share them with you. So congratulations, you have just, I think, 38 weeks na, di ba? 38 weeks. Di ba? 38 weeks. So we have 2 more weeks left for Module 4. And for Module 5, we'll be focusing more on therapeutics. No? And yung ating mga biomedicine, they are best learned if practicum talaga. No? We have mannequins there at LAMP. And I want you to be prepared before you go there. I will try my best to come up with videos on surface anatomy as per PITAC guidelines, the required number of hours. But you'll have time to always look at the notes before you see the real thing. Okay? So from the mannequin, you go to the patient, and then since master nyo na the uses of the points, the indications, then how could we all go wrong, diba? So it's so easy. So thank you po. I know that you're all excited to embark on a very illustrious career, and thank you so much, everyone. So are there any questions po? So Dr. Sam,
do you have any question ako daw?
Sige po.
Are you coming on December 14th?
My spirit will be with you, no? We can always kasi parang okay naman, yeah. Sige, anyway, I'll see. But always
Tapos diretso Baguio, Doc.
Huh?
Diretso Baguio.
With all the traffic.
Oh, traffic talaga yan.
Yeah.
Ay,
actually, parati naman
po.
tayo nagpa-party when I'm there, di ba? Oh.
Oo nga.
Sige, dapat nagpa-party na kayo this week. I tell you, next week is too busy already. Sa totoo lang. Thank you, Dr. Sam, ha? Yun ba yung question mo? Akala ko ano na.
Yun lang eh.
Okay, anyway, when babawi po tayo next year, no? And I hope I'm sure you're aware that mayroon tayong revalida to be given by I'll not be part of the revalida team. So si Dr. Gavino will do it, si Dr. Webb, and also I'm thinking of another one CA. Okay? So yon. Of course, you can do it. It's all very easy. Sino pa ba? Okay, Ma'am Ami, do you have any questions?
Sana po maka-attend kayo sa party.
Sige po. Kung ganun lang sana kabilis pumunta ng Manila, no?
Kaya nga po, Dok.
Padala nyo na lang via Zoom ang kakainin nyo. Sige, I'll be with you in spirit. Angelita Rambo. Thank you po. Thank you po.
Doc.
Yeah.
Doc, pwede umirit ng tanong.
Opo.
How does kidney 6 affect closing and opening the eyes, Doc?
Okay, we'll talk about that when we discuss the EOVs, extraordinary vessels. Okay?
Okay.
Yin Chow Mai, Yang Chow Mai. Mamaya na lang yan. For now, you should know na it has something to do with, meron tayong treatment dyan. Yung dalawa yan eh. Meron pa isang point. Like, there are people na who cannot open their eyes, like tulog ng tulog. Meron ding iba, hindi makatulog. Okay? So, yon. Okay, so who else? Ma'am Annalyn, how are you in Bicol? You look happy. Na-busy yata. So, thank you po sa lahat. Ma'am Angel, I know you're happy din.
Thank you, Doc. Merry Christmas din po, advance.
Yeah, Merry Christmas. At dapat naman araw-araw Christmas no? Di ba?
Yes, Doc.
Yeah, Ma'am Joy. Thank you. You are amazing. Ang bilis mo
Thank you po,
nakahabol.
Doc.
Grabe, no? The system pala is working. Grabe. I
Yes,
just
Doc.
met you in Baguio and now effective.
Bilis nga, Doc Ang bilis nga
Bilis. I cannot believe it, no? I could not believe it. So she must be probably attending lectures. Ay, oo naman.
Siyempre, Doc.
Of course. So si Sir Michael, how are you, Sir Michael? Sir Michael.
All good naman po, Doc. Merry Christmas po. Sana nga po, padadala ka namin ng budget.
Sige po.
Joke lang.
Gusto lang po talaga dyan para kumain. Grabe. Okay.
Okay.
So, pasalamatan din natin si Dr. Gavino who is really observing us. Probably he's also happy that you are all very good. So, thank you so much. I think I've met the cream of the crop. Although marami pang iba, hindi lang nakapunta. Diba? So, pwede na to. I'd rather focus on few students pero quality. Okay? So, yeah, maraming salamat po and thank you for inviting me. Malay mo, okay. Thank you very much po. And good night.
Good night. Good night,
Keep
Doc.
watching the
Good night
videos.
po. Thank you po, everyone.
Thank
Thank
you.
you, everyone.
Stay
Oh,
happy. Okay,
Happy.
wag mong namnamin yung depression na lecture. Okay, thank you po. Bye-bye.
Good night po.
Everyone. Bye-bye.
Mars.